What's up, family? This is Dr. G with Be Organic with Dr. G. I'm coming at you tonight to try to help you guys with that pain that you get when you wake up every morning. You don't go to bed with that pain, and you're like, honey, I think we need to buy a new bed. So the main reason, one of the reasons why this happens is because overnight our spine rehydrates. So throughout the day we have gravity on us and it's bringing us down, it's squishing our discs together, and it's making everything get shorter. At night we take that gravity off because we're laying down, we're whatever position you're laying in, that gravity still isn't on the top of your head and your shoulders compressing that spine. So at night, as the body starts to rehydrate those discs, they start to space out, they start to get a little bit longer. And what happens when you do that, your muscles that are around your spine, that are around that lower back and around that core, they get a little bit tighter, right? And because you're not moving, blood isn't circulating as well it is when you're up and you're moving around, maybe you're exercising, things like that. So you go to sleep, lower back's fine, you wake up in the morning, and the key to this is that it's not when you open your eyes in the morning, it's when you take that first couple steps out of bed, and that's when that pain hits you. This is the video for you. This is the video for you, your friends, your family. They're always saying, God, every time I wake up in the morning, those first couple steps, they just kill me. And then I spend like an hour, 2, 3 hours just trying to get my body warmed up and ready to go. And then that lower back starts to kind of feel a little bit better. And then the next morning it happens over and over again. And one of the biggest things that we do is we look to our bed, we look to that mattress and say, oh, well, I need a new mattress. And maybe you just bought a mattress 2 years ago and now you're already saying, well, maybe we should buy another one. Try this first on top of getting adjusted. If you're not getting adjusted, your spine isn't moving right, you're still gonna have those issues. But these 2 exercises should help a little bit, hopefully. Give them a try. If you want to consult with your doctor, with your chiropractor, if I'm your chiropractor, talk to me about it. Find out, is this something that I should be doing? Is this something I should be trying? Either way, for the most part, these exercises shouldn't be really something that should cause pain. If you are experiencing any pain whatsoever with these 2 exercises, stop immediately. Talk to somebody, talk to your doctor, talk to me, post a comment, post questions, things like that, and I'll try to help you as best as I can, or I'll have you come in the office and we'll take a look at it. But these 2 exercises, one is that windshield wiper exercise where we're rotating a little bit. I'm going to show you in a minute, but we're rotating a little bit, starting to get those muscles to do that cross rotation in that lower back. Again, we're pumping blood into that lower back because, again, at night, you're not moving. So what happens is, let's say maybe you sleep on your stomach as well. Now your lower back is really caved into that bed. Everything is squished together and your muscles shut off when you're sleeping, which means you don't have that muscle there to protect you. Your body literally just sinks in, jams together, and now you've got stagnant blood flow, inflammation creating overnight, and you wake up and now again you have this problem. So by using this mechanism or these 2 exercises to get the blood flowing and circulating, one, you're pushing the inflammation out of that area and getting new fresh blood into that area. You're also kind of priming that pump. It's just like a warm up for a workout. You're getting the body ready to do something, and you're getting the body ready to start your day before you get out of bed. Now, I'm going to show you also at the end how to get up out of that position, not just throw yourself out of the bed, because one of the things we want to avoid if you're having those lower back injuries is doing that tuck position here at the waist, because what happens is, especially if you have disc injury, whether it be minor or major, you put pressure on the front of that disc, it pushes material toward the back, which is usually a lot of the times where those discs herniate, and it will irritate that disc towards the back. So imagine this, you're laying in bed, you open your eyes, before you even get out of bed, before you even try to attempt to get out of bed, you're gonna start this exercise. So open your eyes, you may be laying like that, whatever position you're laying, get on your back, bring your feet together, knees together, hands comfortable here. It's up to you if you want to have your head laying all the way flat back. If it's more comfortable to be here, either one is okay. The biggest component to this is we engage that core. We squeeze the core all the way around so that it's controlled. That core is that body's built-in lower back brace. So we want that stable. We're starting the day getting that ready, okay? So hands on the floor, Squeeze the knees together, squeeze the core, head up or down. It's up to you, whatever's more comfortable. And you're just gonna go side to slide, slow and controlled. You're gonna do about 10 to 15 to both sides. Again, if you can't tolerate that many, don't push it. If you can tolerate more, that's okay. Start with that 10 to 15, and then if you need to work up a little bit, work up a little bit. But it's just starting here, that slow, controlled. You see how I'm getting that twist into that lower back? The body's kind of pulling over a little bit, but I'm not just letting my hips drop down like that. We want it controlled. We don't want any sudden movements. After that, you're gonna come into a bicycle kick. Okay, so if your body can handle it, you're gonna come up and you're gonna do about 10 to 15 on each leg. Again, either head up or head down, either one, but always that core is tight. You stabilize yourself here. Now, if this is too painful, you can keep the feet on the bed and go down like this. You're still getting the body to engage. You can come all the way down. You're getting that stretch through that hip flexor that attaches to the inside of the thigh, all the way back into that lumbar spine. You're getting that to pull a little bit, getting to come on up while you're engaging the core. If you want to, you can even make it a little bit harder. Come up and down, up and down. Again, we're squeezing that core up and down. Now, if you have lower back pain, again, we don't want to go up like this and just throw ourselves into that position to get out of bed, right? So what you want to do is this is the outside, the floor, the rest of the room, bed, rest of the bed's over here, okay? You're gonna bend that knee and you're gonna use that leg to push down, squeezing the core still, and rotate your body to your side. Okay, so you're using that leg to push down, you're using that as leverage. Okay, you're coming like this. Now, if I was laying on the bed, I would swing my legs off of the bed. So they're coming down, getting towards the floor. Again, squeezing that core. Use your hands to walk the body up like this, right? So we're not forcing that core or that lower back into a compromised position. We're using their body to kind of walk up. Now, the next part I'm going to show you, I'm going to switch positions and I'm going to go over here to this ottoman. So when you stand up and you sit down, switch over here. When you stand up and you sit down, so I'm on the edge of the bed, right? One of the biggest things that we try to do is we want to go here and we want to throw our body weight and push ourselves up, right? That's a big mistake. A lot of times that will catch you because, again, we're taking the weight off of the lower back, we're decompressing, and then we come up and we let go, and then sometimes that grabs us. You have difficulty going all the way straight. That's not going to help you by taking the weight off, and then all of a sudden your body's got to catch it, okay? Also, most of us are quad dominant. So one of these things that we can keep doing, and we want to get the glutes and the hamstrings to start firing. By the way, check out the video. The title is Use It or Lose It. Halfway through that video, I teach you how to do a glute bridge. One of the other great things to help with that lower back pain is that glute bridge, get the glutes to fire. But this is something that you can do every time you stand up or you sit down out of a chair, right? So I'm gonna slide to the edge of the bed, edge of the chair, you may be at work, and you're gonna get your weight in your heels, right? So when you put your weight in your heels, your hamstrings, your glutes can actually fire, right? I'm a little bit lower than you typically would be out of a bed or a chair, so pardon it. But I'm not gonna throw my body up like that, because when you do that, you take all the weight out of back here, my weight's on my toes, and I'm basically just pushing the knees back with my quads, and then now I have to use my lower back to come up like this. Again, something that could possibly cause it hurt. So what we're gonna do, start with your hands here, squeeze that core, feel your weight in your heels to where you can kind of come up like that, right? And you're gonna come out of that squat. See how my weight is still back that way? I'm using those glutes to drive the hips forward and keeping that weight back there to come up this way. Again, core is tight. That will start to help take the pressure off of that lower back that all of a sudden is gonna make you do that jolt or spasm. If you like the length of this video, I'm trying to get it more consolidated into something that you can say, here, do this, look at that. If you like the length of the video, like the amount of content, please let me know, give me some feedback on it. I appreciate everybody who is commenting, liking, sharing, everything like that. Again, this was Dr. G with Be Organic with Dr. G. Thank you so much for watching. You guys have a blessed day. Take care. Bye.